I'm Dr. Mangalam, working as a consultant nephrologist. Diabetes is one of the lifestyle-induced diseases worldwide, and India is going to become a diabetic capital of the world also. Hence, the diabetes and the blood pressure, that is high blood pressure, which we call it as hypertension, both are the causes major for the having the kidney problem. So it's better before you develop a diabetes or the blood pressure, it has to be controlled. There are so many lifestyle modifications what you have to do. That is, it depends upon your diet modification and also the exercise. When you are detected to have diabetes or the high blood pressure, it is better to baseline evaluate the other organs of the body which it can affect. Likewise, eyes, heart and the kidneys. Or once in 2 years it has to be done. Usually, the kidney disease, it is a silent killer. Once it enters into a end stage kidney failure only, you will have signs and symptoms. If it is detected in the initial stages, so that you can prolong the time when you end up with the end stage renal disease. Usually you have to modify your diet. There should be a salt and fluid restriction, and also your blood pressure should be well controlled. Blood sugar has to be well controlled. In spite of all these things, if you end up in a end stage renal disease, that time you have to undergo a dialysis or the kidney transplantation. So dialysis, it will be of two types. That is, one is that is the hemodialysis, another one is the peritoneal dialysis. In dialysis, usually we pass that blood through the machine which is equivalent to the kidneys, and we will clean the blood of the uremic toxins and give back the same blood to the patient. To have a good quality of life, patient should undergo 12 hours of dialysis, that is 4 hours every alternate days, that is it will be 3 times in a week for a good quality of life. The dialysis can be done like that. Apart from the hemodialysis, we have a peritoneal dialysis where we will fill up the fluid into the abdomen, and according to the whatever the calculation we have done, it will be there for 4 to 8 hours. The patient can do their own activities that time, and later we have to remove that fluid and refill a different new fluid. That is also, it's a good type of dialysis only. Apart from the dialysis, if they have the same blood group relatives and their tissue matching is okay, it is correct, then they can go ahead with the kidney transplantation. So one of the kidneys will be removed from the donor and it will be inserted into this patient, and for life one kidney is sufficient. Donor won't have any problem giving one kidney to the patient. So for the day-to-day life, one kidney is sufficient. So God has given us 2 kidneys. So one we can give it to the others. But these patients have to have a regular follow-up every month at least, and they have to be on lifelong medications, which the dosages will be altered time to time. That usually the kidney diseases, when it enters into the end stage only, they will have signs and symptoms. They might be having some swelling of the feet, or there might be facial swelling, or around the eyes they can have the swelling. If the fluid gets accumulated in the lungs, they will come with the breathlessness, and their urine output, it can be reduced, or the color of the urine, it can be changed to pink to red. So that what we call it as hematuria. And also, when they are leaking protein in the urine, they will have lot of froth in the urine. So initially patient can present with the swelling of the lower limbs, or the urine output it is modified, or they are having a frothy urine. They can also have other symptoms, like that is vomiting sensation or vomiting, and they don't have any appetite, or they will have an aversion to food. They are not feeling to eat anything. There can be a lot of weight loss. Usually they will present with these symptoms only. But if the kidney failure has affected their brain also, means they can present with the fits. or loss of consciousness, neurology department, you can have a OPD consultation. Depending upon that, we will be evaluating the patient, and we have hemodialysis facility here, where we do the maintenance hemodialysis in shifts. Presently we are doing 2 shifts for the patients, each of 4 hours, and we have an admission facility also, where we can admit and treat the patients with the kidney failure, and we have a very good ICU setup, so any emergencies we can manage in these patients.
కిడ్నీ మూత్రనాళము మూత్రాశయంలో రాళ్ళు దానికి సంబంధించిన ట్రీట్మెంట్ చేస్తాము. రాళ్ళ ట్రీట్మెంట్ ఎండోస్కోపీ ద్వారాను ఓపెన్ సర్జరీ ద్వారాను చేయబడుతుంది ఇక్కడ. అలానే కిడ్నీను మూత్రనాళం మూత్రాశయం సంబంధించిన క్యాన్సర్ గడ్డలు కానీ మామూలు కంతులకు కానీ ట్రీట్మెంట్ చేస్తాము. అది ల్యాప్రోస్కోపీ కానీ ఎండోస్కోపీ కానీ లేదా ఓపెన్ సర్జరీ ద్వారా కానీ చేస్తాము. అలాగే పురుషుల్లో మరియు స్త్రీలలో వచ్చు మూత్రాశయం సంబంధించిన బాధలు, అంటే మూత్రం సంబంధించిన మంట కానీ, మూత్రంలో రక్తం రావడం కానీ, మూత్ర కుసాలు రావడం, వాక్కుండా కారడం లాంటి సమస్యలకు ఇక్కడ వైద్యం చేస్తామండి మేమందరం. ఈ ప్రాంతంలో ఎక్కువగా మనకు మూత్రాశయంలో కానీ కిడ్నీలో కానీ రాళ్ళు ఎక్కువగా కనిపిస్తుంటాయండి. మోస్ట్లీ అంటే నీళ్ళు సరిగ్గా తీసుకోకపోవడం వల్ల, ఆహార పద్ధతులు సరిగ్గా లేకపోవడం వల్ల వస్తుంటాయి. అవి వచ్చినప్పుడు కడుపు నొప్పి, ఒంటికి మూత్రంలో మంట రావడం లాంటివి జరుగుతుంటాయి. అలానే క్యాన్సర్ అంటే మూత్రంలో మంట వచ్చినప్పుడు, రక్తం వచ్చినప్పుడు, లేదా తెలియకుండా బరువు తగ్గుతున్నప్పుడు కానీ క్యాన్సర్ మనకు డయాగ్నోస్